In this video, I will talk about neonatal conjunctivitis, which is also commonly known as Ophthalmia Neonatorum. Conjunctiva is a semi-transparent mucous membrane which covers the inner surface of the eyelids and the white matter of the eyeballs, which is called sclera. According to the location, the conjunctiva is divided into two types, palpebral conjunctiva and the bulbar conjunctiva. The palpebral conjunctiva covers the inner surface of the eyelids and it is firmly adherent. It is extremely thin and highly vascular. It is strongly bound to the underlying tarsal plates. Bulbar conjunctiva covers the interior surface of the eyeball. It is thin and translucent. It is loosely attached to the underlying sclera by a tenon's capsule. Conjunctivitis means inflammation of conjunctiva. Now, neonatal conjunctivitis or Ophthalmia Neonatorum presents in infant in their first 4 weeks of life, and it is the most common eye disease of the newborn. Neonatal conjunctivitis may be aseptic or septic. Aseptic or chemical conjunctivitis is induced by silver nitrate solution, while bacterial and viral infections are the major causes of septic conjunctivitis. Regardless of the cause, Ophthalmia Neonatorum is characterized by redness and chemosis of the conjunctiva, edema of the eyelids, and a discharge which may be purulent. Infants usually acquire these infective agents as they pass through an infected birth canal of their mother during the birth process. And conjunctivitis is more serious in neonates because the immune system is immature and there is lack of lymphoid tissue in the conjunctiva, and also because tears are absent at birth. The etiology of neonatal conjunctivitis can be chemical or microbial. Silver nitrate is a surface-active chemical which is used at birth for prophylaxis of infectious conjunctivitis. At low concentration, that is 1%, it is okay, but at higher concentration, it is toxic to the conjunctiva. Chlamydia trachomatis is an obligate intracellular parasite and is the most common infectious cause of the neonatal conjunctivitis. Neisseria gonorrhoeae is a gram-negative diplococcus and it is the most dangerous and virulent infectious cause of neonatal conjunctivitis. Now, common gram-positive organisms which are responsible for causing neonatal conjunctivitis include Staphylococcus aureus, Streptococcus pneumoniae, Streptococcus viridans, and Staphylococcus epidermidis. And these gram-negative organisms account for about 30 to 50% of all cases of infectious neonatal conjunctivitis. Gram-negative organisms may also cause neonatal conjunctivitis, especially in preterm and low birth weight infants. And the organisms include Escherichia coli, Klebsiella, Serratia marcescens, and Proteus, also Enterobacter and Pseudomonas species. Herpes simplex virus is a rare cause of neonatal keratoconjunctivitis, and it is found in less than 1% of the cases. Now I will discuss the clinical presentation. First, the chemical conjunctivitis, which is due to silver nitrate solution. It usually occurs within 6 to 12 hours after birth, and the clinical picture is usually mild with transient tearing and conjunctival injection if only 1% solution is used, and it resolves spontaneously within 24 to 48 hours. If silver nitrate solution is present in a white container and it gets dried up, then it becomes concentrated. So if this concentrated solution is used, then it may result in eyelid edema, chemosis, exudate or pseudomembrane formation. And in severe cases, permanent cicatricial damage to the conjunctiva or cornea may occur. Gonococcal conjunctivitis is the most serious form of neonatal conjunctivitis. The incubation period is 2 to 5 days and it usually occurs 24 to 48 hours after birth. But it may be present at birth or it may be delayed beyond 5 days of life if some ocular prophylaxis has been used. Gonococcal conjunctivitis may also occur in infancy after inoculation by the contaminated fingers of adults. In gonococcal conjunctivitis, initially there is mild inflammation and a serosanguineous discharge. But within 24 hours, a thick purulent discharge forms and there is tense edema of the eyelids along with marked chemosis. Complications of gonococcal conjunctivitis are common in neonates, and these include corneal ulceration and perforation, iridocyclitis, anterior synechiae, and panophthalmitis. In gonococcal conjunctivitis, systemic manifestations may be present like rhinitis, stomatitis, arthritis, meningitis, anorectal infection, or even septicemia. Chlamydial conjunctivitis usually occur 5 to 14 days after birth. Now, it is usually a mild inflammation and there is a unilateral or bilateral watery discharge. Chlamydial conjunctivitis usually affect tarsal conjunctiva. As I have mentioned that chlamydial conjunctivitis is usually a mild inflammation, but rarely it is a severe disease in which there is eyelid swelling, copious purulent discharge, pseudomembrane formation, and a thickened palpebral conjunctiva, along with peripheral paleness and corneal opacification. In chlamydial conjunctivitis, there may be extraocular involvement such as pneumonia or otitis. Now, incubation period for other bacterial neonatal conjunctivitis, which include gram-positive and gram-negative organism, is also 5 to 14 days, and it is also a mild infection like chlamydial conjunctivitis. However, Pseudomonas conjunctivitis is a very serious disease. It is usually acquired in the nursery and it occurs 5 to 18 days after birth. In Pseudomonas conjunctivitis, there is edema and erythema of the eyelid. There is a purulent discharge along with venous formation. There may be endophthalmitis, sepsis, shock, and even death. Herpes simplex keratoconjunctivitis occur within 2 weeks after birth. Incubation period is usually 6 to 14 days. It is usually associated with generalized herpes infection in which there are vesicles on the skin and the eyelid margins. Herpes simplex keratoconjunctivitis is characterized by eyelid edema, moderate conjunctival injection, non-purulent or serosanguineous discharge, and microdendrites or geographic ulcers which are typical of the herpes simplex keratoconjunctivitis. In severe cases, there may be conjunctival membrane formation and corneal scarring. Now, herpes simplex virus keratoconjunctivitis may be associated with disseminated infection or herpes simplex virus encephalitis. Now, I will discuss the diagnosis. Neonatal conjunctivitis, which appear 48 hours after birth, should be evaluated for a possible infectious cause. Now, gram stain and culture of the purulent discharge should be performed. If a viral cause is suspected, then a swab should be submitted in tissue culture medium for virus isolation. In chlamydial conjunctivitis, conjunctival scraping from the tarsal conjunctiva should be examined by Giemsa stain. Chlamydia can be isolated from a conjunctival swab using special tissue culture techniques. Also, immunofluorescence staining of the conjunctival scraping can be done for chlamydial inclusions, or detection of chlamydial antigen or DNA can be done by PCR assay. But these are expensive tests and they are not readily available. Now, the cytologic findings in various types of neonatal conjunctivitis are as following. In chemical conjunctivitis, there are neutrophils and occasional lymphocytes on the gram stain. In bacterial conjunctivitis, gram-positive or gram-negative bacteria are identified along with the neutrophils. Now, in gonococcal conjunctivitis, there are neutrophils and gram-negative intracellular diplococci on gram stain. Now, the cytologic findings in chlamydial conjunctivitis. On gram stain, there are neutrophils, lymphocyte and plasma cell, while on Giemsa stain, there are basophilic intracytoplasmic inclusions in the epithelial cells. In herpetic conjunctivitis, there are lymphocyte, plasma cell and multinucleate giant cell on gram stain, while there are eosinophilic intranuclear inclusion in the epithelial cells on Papinacle smear or the Pap smear. Now I will discuss the treatment. Newborns with conjunctivitis should be admitted for full workup and treatment and avoid eye patching. Now, because of the rapid progression of gonococcal conjunctivitis, all neonates with acute conjunctivitis should be treated for gonococcal conjunctivitis until the culture results are available. The treatment is then altered according to the laboratory results. So for the gonococcal ophthalmia, treatment consists of ceftriaxone 50 mg per kilogram per 24 hours for one dose, and it should not exceed 125 mg. The eye should also be irrigated initially with saline every 10 to 30 minutes. It is gradually increased to 2-hour intervals, and this is done until the purulent discharge has cleared. Alternative treatment for gonococcal conjunctivitis is cefotaxime. In case of extraocular involvement and severe infection, the dose is 100 mg per kilogram per day intravenously or intramuscularly every 12 hours for 7 days. But in case of mild infection, single dose of 100 mg per kilogram is enough. Other alternatives are penicillin G or systemic gentamicin, depending upon the susceptibility of the organism. Pseudomonas conjunctivitis is treated with systemic antibiotics including aminoglycosides, local saline irrigation, and gentamicin ophthalmic ointment. Staphylococcal conjunctivitis is treated with methicillin and local saline irrigation. For neonatal chemical conjunctivitis, artificial tears are used for lubrication. Herpes simplex conjunctivitis is treated with systemic acyclovir. Dose is 60 mg per kilogram per day intravenously, divided 3 times a day for 14 or 21 days. Now, topical ophthalmic drugs like trifluridine or vidarabine or ganciclovir, these are available, but they are not specifically approved for the neonates. Now, in the end, I will discuss the prevention of neonatal conjunctivitis. Prophylaxis at birth is important. It is given in the form of 2 drops of 0.5% erythromycin or 2 drops of 1% silver nitrate. These should be instilled directly into the open eyes of the neonate. Povidone iodine 2% solution is also used as prophylaxis for neonatal conjunctivitis. Now, infants who are born to mother who have untreated gonococcal infection, they should be given ceftriaxone 50 mg per kilogram intravenously or intramuscularly plus topical prophylaxis. Penicillin can also be used if the mother gonococcal isolate is penicillin sensitive. Antenatal diagnosis and treatment of maternal sexually transmitted disease is important for the prevention of neonatal conjunctivitis. Parents should be advised to wash hands frequently in order to prevent the transmission of infection to their babies. Thanks for watching this video. Please like, share, comment and subscribe to my channel.